will be sorted out of the way shortly. So an extra guest in the back, one part of the joy of being from home. Thank you, Ian, very much indeed, and welcome all to the seminar. My thanks as well to everybody who's been involved in planning this at some speed, but I think we all felt this was a really important theme, as Ian has said, and I know from Ian's comments about the GCVS survey, that it's been a big issue during the pandemic, is how people respond to the mental health needs. So my job is to try and give you a bit of an overview and a flavour of some of the themes and issues. I think, and very much looking forward to the other two speakers from Lifelink and GAMH Carer Centre. We're really particularly keen to get all of your comments and views in the discussion session. So that's really the heart of this event. We're really keen to learn from your experiences, how you've been responding, what the unmet needs might still be. So that really is how the whole session's been designed. Let me take you through. Now, you'll bear in mind I've got several laptops around me, so I'm going to consult my notes as we go. If I look like I'm looking slightly to one side, that's why. My son's laptop hopefully will stay in charge. So the joy of working from novel situations, isn't it, which we're all coping with. What I want to do is to, and I should say my role, as Ian says, is Health Improvement and Inequalities Manager at the Health Board in Glasgow, and I'm also co-chair of the National Mental Health Special Interest Group with my colleague Jane Bray from Tayside. So we've been doing some work at the national level as well in the last few weeks. I'm trying to bring you a flavour of some of both of those in my 10-12 minute piece. What I want to start by doing is to acknowledge the fact that during the pandemic, mental health issues have come to the fore really in a really big way. I think those of us who are tracking it from early on in China and Hong Kong and Italy and so on can see that mental health issues really were a big part of that, and you've probably seen a lot of that commentary. So we kind of knew that this was coming, and I guess it gave us a bit of a chance to start to think and prepare, but we didn't really know what was coming in terms of the details of lockdowns and so on, a whole range of issues. It's been a long 2 months, hasn't it, in terms of coping with all that's been thrown at us. But I think the one thing that I and my team, the Mental Health Improvement team, have been pleased on is that mental health issues haven't got submerged and forgotten about. It does feel like they've been given quite a lot of attention, which is good. Not enough support maybe, but I think lots of support has been happening. Keen to hear your experiences of that. And I want to start with a little bit of a global take on this. Quite early on, early April, I and my team were scanning some of the international scene as well as the local scene. And I came across a guy called Professor Daniel Aldridge, who is a fascinating guy. I'm going to tell you in a couple of minutes a little bit of his story, which I found fascinating. He had moved as a young academic to New Orleans in 2005, I think it was, with his very young family. And at that precise point, they were just getting settled into the new home when Hurricane Katrina came along. And not knowing the city at all and how the flood defences worked, he thought, I'll be fine, I'll stay put with my family, we'll ride out the storm. And at the very last minute, one of his new neighbours came to him and said, you have to get out, we're all going, you need to come too, the flood defences won't hold. And they basically dragged him out and his family out and saved his life, because within a matter of a day or so, his entire neighbourhood was wiped away. And he was so, obviously it was a traumatic experience, but he was so impressed by the neighbour intervention that he changed his entire career to focus on researching disasters and human responses to disasters and recovery from disasters. So he studied 9/11, he studied Japanese earthquakes and so on. And if you've seen the paper that's been, one of the papers that's attached to your package for today, which is the public mental health response, I've quoted some of his work there, so you can chase upon that. He's now at University of Boston. But his main finding, I think, really struck a chord with us and with what we were seeing happening in Glasgow, which is the big theme is community connection and community resilience. So if you have good social connections at the start of a disaster, it can really help you get through that. The people that have those good ties at the start tend to do a lot better a year down the line or 2 years down the line. So having that good community cohesion is hugely important. I think what we were seeing is exactly the same in Glasgow, a huge grassroots response going on right from the start, not just mental health organisations like GAMH and SAMH and so on, but every community organisation, neighbourhood groups springing up. So I think people instinctively doing the right thing. Let's build as many connections as we can. We may be locked down with a physical distancing, but it doesn't mean we should sever all the social connections. There can be a huge response in terms of volunteering and community effort. And I would say that happened quicker than some of our statutory agencies who are then looking to galvanise and respond. support that as well. So I'll come back to that later on, but that theme of community cohesion is hugely important. Some of the other signals we were seeing as a team, and if you like, help seeking, were people looking for information very early on. So as a team, we've been producing a range of summary materials and help materials. If you haven't seen those, we can get, we'll put some details. I know Michelle's on the call, so maybe you could ping on the chat function, Michelle, the link to our team page where you can download resources and so on. But we also saw in a huge range of agencies doing some great work in the very first few weeks. Mental Health Foundation, SAMH, Young Scott, Young Minds across the UK, a huge wealth of material, almost too much at times. So trying to navigate through that and give people helpful information was a part of it. And we've learned a lot from so many agencies and trying to channel that to the people who need that help. I think that question maybe for your discussion groups as well is how easy did you find it to get that kind of help and information? What else do you need? We may be moving to a new phase now. So what are the different needs that people need to respond to as the lockdown starts to ease in a maybe slightly raggedy way? I don't want to say too much about research, but I want to mention a couple of the really impressive pieces of tracking research going on across the world, but in the UK. There's dozens of them. So if you're particularly interested in that, you could track something called covidminds.org. I'll put the web link in the chat function when I finish. But one of those studies is called COVID Life. It's been run by Edinburgh University. I think we've got 15,000 participants, 80% of whom are in Scotland, so it's very relevant material. I'm not going to try and thank you, Michelle. I can see that pinging in. That's great. And Heather as well. Thank you. So I'm just going to pick out one piece from that study, and I can maybe also put a link to that if you're interested in that study, or you just search for COVID Minds. You'll find the interim report. This covers the period mid-April to mid-May, so pretty recent. What they're saying is significant impact on anxiety, on depression, on sleep, a lot of disorder in terms of people's good quality sleep. And when you look at the age profile, what they're seeing is that the biggest impact has been on the 18 to 29-year-olds by some considerable margin. I think if you added together severe anxiety and moderate anxiety, something like 45% of 18 to 29-year-olds are saying there was a big impact. So just one finding of many, many studies. We're trying to keep a track on a lot of these studies that are telling us what's going on. But the last point I want to make really on the data and intelligence side is your experiences are hugely important data as well. Your intelligence, what's going on with your groups, your communities, and so on is really crucial. So I think we're really keen not to be obsessed purely by academic studies, but what you're learning and how we can work with that in the weeks and months ahead. Just briefly attending to some of the Glasgow dimensions, we know there's been a huge effort underway to cope with the massive disruption of lockdowns, social distancing, many physical services being shut, schools, nurseries, and so on, healthcare services having to be closed to physical contact, and a massive response in terms of people trying to find new ways of doing that. I had a really good session with colleagues at Bipolar Scotland a few weeks ago who turned all of their face-to-face support groups into bi-monthly Zoom sessions, much like this, and they've gone very well by and large from what I can hear. So a huge effort to try and learn new skills, new tactics. Some of the recovery groups have been doing the same. But let me give a few statistics. I don't want to bombard you with statistics today, and just in my last few minutes. We know in the city something like 22,000 people are in the shielded group who are needed to keep physically out of circulation. These things will hopefully start to ease. Another 77,000 people on top of that who consider to be vulnerable in a variety of ways. And that's not to say that those approximately 100,000 people are all in need. There are needs across the whole society. So there's been a colossal level of need, a lot of grassroots support and voluntary sector support. But what more do we need to do? What are you learning? What would you anticipate that will change as we move out of the complete lockdown phase into the so-called recovery phase? And to draw my threads together, you'll see in the pack that you got a couple of documents. One is a piece of work we pulled together a few weeks ago, which is called a public mental health response to the COVID crisis. And if you haven't had a chance to have a look at that yet, I would be grateful if you wouldn't mind doing that. And there's also a fantastic paper from colleagues at Glasgow Centre for Population Health, Chris Harkins, called Community Resilience and Community Recovery and Resilience. So I recommend that to you as well. But I want to finish by reading out the 5 key headings of our response paper, and hopefully this chimes with you. This is based on all that we've seen in the last few weeks in terms of both the academic world and the international dimension, but most importantly, I guess, what we're hearing from the ground in terms of needs and issues emerging. And I'll just summarize these and then finish at that. So one is about the importance of building resilience and connection with communities, drawing on what I said about Daniel Aldridge, and that is major findings on that really helps to protect us during the worst of all of this. Addressing isolation and loneliness, we've seen lots of great examples of that, but I'm sure there's still be people who aren't getting help. Who are they? How do we find them? How do we help them? Distress, loss, anxiety, and support for people with pre-existing mental health problems. How do we make sure that that group who are experiencing even more distress get the help they need? A whole range of underlying drivers. You don't need me to go through the full list. You'll be able to provide a extensive list yourselves, but things like impending unemployment, how much things like being perhaps a victim of violence, being discriminated against. We know that Black and ethnic minority communities have suffered a bigger impact of COVID locally and around the world. So how do we think about particular marginalised groups who need help on the root causes as well as in the mental health symptoms? And then finally, no less important, how do we support staff and volunteer mental health and well-being over the piece? So they're the big 5 things we pulled together in that paper. I'll just finish with the additional thought that keeping communicating, keeping sharing that intelligence, and making sure that we're building mental health thinking into all of our planning, all of the groups in society, not just adults. What about children? What about early years and the perinatal period as well? So hopefully that gives you an overview of what we've been seeing over the last few weeks and months. Looking forward to our other 2 speakers, and then really keen to see in the workshops all of your experiences and thoughts for the period ahead.
Thank you.